Every year, more than 15 million people across the world suffer a stroke. Of these, nearly 6 million die, and another 5 million are left permanently disabled. What exactly is a stroke? And why is it called a brain attack? Stay tuned as we join Dr. Francis on Brights Media. Good day everyone and welcome back to Brights Media. I'm Dr. Francis. And I'm Pharmacist. Today, we're digging deep into one of the leading causes of death and disability worldwide, stroke. What is a stroke? A stroke happens when blood supply to a part of the brain is interrupted or reduced, preventing brain tissue from getting oxygen and nutrients. Within minutes, brain cells begin to die. There are two main types. 1. Ischemic stroke, caused by a blockage. 2. Hemorrhagic stroke, caused by a burst blood vessel. And there's a third, transient ischemic attack, TIA, a warning stroke or mini stroke. It doesn't cause permanent damage, but is a major red flag. Exactly. Time is brain. That's why we often say, act fast, which stands for face drooping, arm weakness, speech difficulty, time to call emergency services. Act fast. Where F means face dropping, A means arm weakness, S means speech difficulty, and T means time to call emergency services. Causes and risk factors of stroke. Some risk factors like age and family history are beyond our control. But many are preventable, like hypertension, smoking, obesity, high cholesterol, diabetes, and even excessive alcohol consumption. As a pharmacist, I focus a lot on patient education, encouraging blood pressure checks, adherence to medications, and lifestyle modifications. It's important people know that stroke is preventable. Symptoms and diagnosis. Common symptoms include sudden weakness, usually on one side of the body, facial droop, slurred speech, confusion, and vision problems. Diagnosis can be done using CT or MRI. It is key to deciding the right treatment and emergency response. In ischemic stroke, if the patient presents early, we can administer thrombolytics like BIT to dissolve the clot. But it must be given within a 4.5-hour window from symptom onset. Every minute counts. Hemorrhagic stroke, on the other hand, requires controlling the bleeding and possibly surgery. Stroke centers are equipped to handle both rehabilitation and long-term care. Recovery depends on the stroke severity and how fast treatment began. Rehabilitation is essential. Physical therapy, speech therapy, and psychological support all play a role. We also ensure medications are optimized, antiplatelets, statins, antihypertensives, and educate caregivers on preventing a second stroke. Preventive strategies. Lifestyle modifications, a must-do list. 1. Healthy eating. 2. Exercise. 3. No smoking. 4. Less consumption of alcohol. Preventing stroke is about managing risk factors, daily medication adherence, healthy living, routine checkups, and public awareness is key. We must educate our communities, especially in places like Nigeria, where access to stroke care can be limited.
Thanks for watching. Please like, share and subscribe.
A big thank you to Dr. Francis and Pharm Lawrence for breaking down this important topic. If you found this helpful, like this video, subscribe for more expert talks, and don't forget, act fast. You just might save a life.